Hi, this is Dr. Stephen Bracci, Verve Medical Cosmetics. If you're considering a consultation for fillers or a filler procedure, this is what you can expect when you enter my studios. So first and foremost, when I enter the room to visit a new client, my first step is to look at the overall architecture of the face and get a first impression or a gestalt to look at what's really in front of me. And I basically ask about the main concerns that the client has, such as whether they appear tired or whether there's an upcoming event. That's usually one of the things that brings people in. Next, I request them to pull their hair back fully off their face so I can get a full view of the architectural details of the face. And it's critical that I do so, my evaluation, from a normal conversation distance. And the critical point to that is that's the key way to evaluate somebody, because that's the way you want to look your best, is at a normal conversation distance. All too often, I have clients who show me details on their face, and they'll have a mirror which is a few inches away from their face showing me details. And the challenge with that, and the problem with looking too close, is that it's really a distorted viewpoint and it's really not taking in the whole overall architecture of the face. So I focus on key areas of the face: the mid-face support, the lateral cheekbones, the nasolabial folds, the marionette area, and the jawline, and of course the under eye area. So those are the main points that I look for. Fillers are essentially used to restore the architecture of the face by compensating for that loss of support that happens with time and age. We have supportive structures under our skin, and as we age, we lose those supportive structures naturally. So we have fat, we have muscle, and a big component of that under skin area is the bone that we lose with time and age, and it causes our skin to fold and shift directions in a very characteristic way. So the face is really truly divided into two main areas that we can fill. There's the medial face, and that's the area that's in the middle of the face, in between the two pupils, and we can add fillers to add for that forward projection. Likewise, we have a lateral area of the face that's outside of that, and that includes the lateral cheekbones and the jawline. So we can create a three-dimensional restoration of the architecture of the face by forward projection and by lateral vectors, and we can create that where surgery is more just in the lateral vector domain. So basically, I assess at that point any prior surgeries. I can look and see if the skin has been shifted and manipulated and there's any surgical history. And then the other thing that I really look for is the history of prior fillers. I can usually tell, even if the clients don't tell me, I can usually pinpoint it, because fillers, often the telltale sign is that when fillers are put in, it doesn't match the adjacent area. Some areas are well filled and it doesn't match other areas in the face, and it's a telltale sign that I see. When I fill, I want to make sure that the skin and the architecture is returning to its natural original position. So after discussing all of the questions and all the potential side effects and complications from fillers, I often discuss, at that point, I leave it to my team member to review the pricing options, whether they're going to do an individual filler or purchase what I call as a procedure. If they purchase a procedure, they'll choose one area, such as, say, the under eye area, then the iris area, and it will be one professional fee, and then that will include whatever it takes, using multiple fillers at multiple levels and multiple visits to get the actual best results. So overall, the consultation is very detailed. It focuses on the architecture, the anatomy, looking at you from a distance, making sure that architecturally things are going to make sense. And the goal is to restore the architecture and the shape to its original rested natural position.